Hi everybody, my name's Claire and I'm a fourth year medical student at the University of Nottingham. Over the last 4 weeks, I've been working on my special study module with Mr. Sami Abdul on setting up and running local and international courses. Over this time, I've also been looking at virtual reality and how it can be used for surgical teaching. In this presentation, I will be talking about the advantages and drawbacks of virtual reality in teaching. So what is VR? VR stands for virtual reality, which is an immersive way of teaching others. It involves 360 camera recordings, which can then be viewed through either a computer, allowing the viewer to move the screen to see around the room, or using a VR headset, which enables you to physically look around the room. So, in terms of VR and how it can be used for teaching, these are some areas of consideration: laws, costs, equipment, effectiveness, and surgical education purposes. So for laws, an advantage is that laws ensure high standard of patient safety, care, and privacy to be maintained. The General Medical Council guidance does not require separate consent from patients for images and recordings taken in body cavities as long as the patient cannot be identified. Some of the drawbacks of these laws is that due to UK laws, video recording of surgery may be restrictive. Due to compliance with laws, permissions will be required from the patient, staff, surgeons, and the hospital trust, making the process more time-consuming. Certain permissions also may be required to upload the content onto websites and streaming platforms such as YouTube. International laws may vary to the UK, therefore making this accessible to users worldwide may be difficult and more complicated. And also, if the laws are breached, there could be serious legal implications both to the surgeon and the trust. So this is an area of consideration to take into account when considering VR teaching. Another area is costs. An advantage is that once the initial costs have been made, the videos can then be used over and over, meaning money would be saved from running in-person courses and training. Also, charges could be put on accessing some or all of the videos to make up for the initial startup costs. For example, a subscription cost for doctors to receive a new VR training video every month could be added, or a charge could be added for schools using and accessing the videos. VR teaching would mean cutting out the costs of in-person training. You wouldn't have to think about catering, hiring a venue, transport, and hiring staff. But the drawbacks to VR is that due to the cost of the VR camera equipment, headsets, editing software, streaming platforms, and staffing costs, it makes it a very expensive venture for the hospital, organisation filming the content, and the school or trainees accessing the videos. So this is a major thing to consider when thinking about VR teaching. There's also a limit. It could limit how many people could use the videos if charges are put on them. For example, schools with low budgets or students like myself. Another area is equipment. An advantage is the camera quality is high. During the past month, we were using VR cameras that had a resolution of 4K, which means the quality of the video was very good. However, the drawbacks of equipment is it's not accessible for everybody to buy. Also, the VR cameras can overheat and lose battery very quickly. And in a surgical setting, this is not ideal. Also, sound quality can be compromised due to the loud machines and busy environments of the operating room. This I experienced, as with the machines, the beeping, the talking, things going on in the background can easily be picked up by the cameras. So that's one thing to consider. VR videos also take up a lot more data storage space. Another area is the effectiveness of VR teaching. An advantage and one of the main reasons to use VR teaching is that it offers the viewers an immersive experience with a 360-degree view compared to a 2D view. This means that the content is more engaging and can capture the attention of its users. Viewers also have control to move around the screen to be able to see different angles of the room. Using VR, viewers are able to experience different operations from the perspective of different roles. For example, you could watch a video from the perspective of a scrub nurse in a total laparoscopic hysterectomy. However, the drawbacks of effectiveness with VR is that you have to position the camera in a very key way. So positioning is very important, and also the camera could get covered up during this operation, meaning that you would not be able to view what is happening on the operating table. Although it is more immersive, it's not as effective as physically being in the operation room. Where you can ask questions directly, you can get hands-on involved, which is a lot more of a different experience. So although VR is very effective, it's not as effective as actually being physically there in the surgery. And the last area of consideration I'll be talking about today is surgical education. One of the advantages is that it gives non-medical students or under 18s who usually or otherwise can't attend surgeries due to age and other factors. It gives them the access to experience what surgery is like, sparking interest for future career prospects. It also means with VR that you're able to teach surgical skills without physically attending. This means it can be used internationally. It can be used also for those who can't travel for distance because they, for example, may have a physical illness or they may be pregnant or other factors. An example of this was during the COVID pandemic, where physical or person contact was limited during this time. This is where something like VR could be used. Another advantage is that it could be used for a number of different surgical specialities. It can be used for health and safety training. It can be used for surgical skills such as scrubbing in, suturing, and it can also be used for introduction training. A drawback, however, is if the videos are not live, then the viewers are not able to ask questions directly about what is happening. Therefore, it reduces understanding of the procedure or what's going on. So, in summary, is virtual reality the future? With technological advancements and artificial intelligence being used in all areas of life, inevitably VR will be used more and more for education and training in the UK, especially in the medical sector. There was a study done in 2021 when 96% of participants on a VR training course said they would recommend VR simulation to their peers. Through VR teaching, viewers are able to be more immersed and involved in their learning experience. And in early training, medical professionals are able to build up their knowledge and confidence with surgical skills and emergency scenarios before actually going through those situations. However, it's important to acknowledge the limitations, the costs, the laws involved with VR. Although it's a wonderful teaching tool, the effectiveness as a standalone resource would not be adequate to train a medical professional, and in-person training would still be required at some stage of their education. That's all for the advantages and drawbacks. Thank you very much for listening.